Acne is one of the top 3 most prevalent skin conditions seen in the general population. Acne affects 85% of young adults aged 12 to 25. Acne is not just a rite of passage all teenagers experience. Acne can have significant psychosocial impact. Moderate to severe acne may result in depression. Depression may manifest as social withdrawal, retreat to the bedroom, or avoidance of peers, or impaired school performance, lower grades, or missed assignments. Severe depression from acne has resulted in attempted suicide and, unfortunately, successful suicide. Acne and acne scarring may affect professional success. Acne patients are less successful in job applications, their lack of confidence being as important as the potential employer's reaction to their spotty skin. More people who have acne are unemployed than people who do not have acne. What is happening in the skin with acne? The first issue is that the follicles close off, and that's what gives you a fine bumpy texture difference before anything ever gets red. After the follicle closes off, you can get a buildup of sweat and oil, and a certain bacteria called Propionibacterium acnes will grow and result in red and inflamed papules, pustules, nodules, and cysts. Hormones definitely play a part. That is why we see acne during the teenage years, is because your skin is trying to get used to the hormones that your body's creating. Genetics. There is an increased incidence of acne in children whose parents or siblings suffer from acne. Acne may present as comedonal acne. This is the fine bumpy texture difference, including open comedones, also referred to as blackheads, and closed comedones, in which the epidermis covers the follicular opening. This form of acne rarely scars. Papular-pustular is the more red and inflamed type of acne. We may start to see some scarring potential with this type of acne. Nodular cystic lesions are larger, more red, more inflamed. These lesions are likely to scar. Treatment for this type of acne should be aggressive to minimize the scarring. Let's take a look at our treatment options for acne. Any over-the-counter treatment should be utilized for at least 2 months to see the benefits. Most acne marketed products will contain benzoyl peroxide 2 to 10% or a salicylic acid. Benzoyl peroxide is a broad-spectrum bactericidal agent. It has anti-inflammatory, comedolatic, and keratolytic activities. What do these terms mean? Anti-inflammatory results in a reduction of the red lesions. Comedolatic means it breaks up and opens the comedones. And keratolytic resurfaces the top layer of skin. Benzoyl peroxide is marketed in many formulations for acne. It is a good product to use in any acne treatment regimen because it also helps to prevent bacterial resistance. Be careful with this one though, it might bleach your clothing, towels, or washcloths. Salicylic acid is available over the counter in various different concentrations for the treatment of various different skin conditions, such as warts, dry skin, flaky scalp, fungal infections, and acne. Like benzoyl peroxide, it is comedolatic and keratolytic, meaning it breaks up and opens comedones and resurfaces the top layer of skin. Salicylic acids have some anti-inflammatory effects, but can also be very drying. So some patients will get irritated from salicylic acids. Alpha hydroxy acids, such as glycolic acid and lactic acid, help to resurface the top layer of skin and may help with pigmentary issues as well. These products will make you sun sensitive. Differin, or adaptoline, the 0.1% gel, went over the counter in 2016. This is a wonderful starting place for over-the-counter treatment for acne. It works well for comedonal acne and has anti-inflammatory benefits. Differin can be very drying to the skin and will also make patients sun sensitive. Prescription topical medications. We just discussed adaptoline or Differin in the over-the-counter treatment options. It is one of our topical retinoids. Topical retinoids help to prevent, heal, and repair the skin. These are not only good for acne treatment, but also have cosmetic benefits. They are comedolatic, they break up and open comedones, resurface the top layer of skin, as well as work on dermal repair and thickening. They also help to reduce pigment. They can be beneficial for fine lines and wrinkles as well. So if we're going to do anything for acne, we should have patients on a topical retinol. They do make you sun sensitive, so we do have to be careful and make sure our patients are wearing sunscreen in the morning. There are three main topical retinoids: adaptolene, tretinoin, and trazodone. Adaptolene, also known as Differin. Tretinoin has multiple different branded names: Retin-A, Atrilin, Altrino, to name a few. Trazodone, also known as Tazorac or Favior. I like to think of these topical retinoids on a spectrum. At one end, we have tolerability as well as how well it works. At the other end, we have more drying and irritation, but they tend to work better. I usually start with adaptolene and work my way into tretinoin. As we get into tretinoin and the various different strengths, it may be a little bit more drying and irritating, but it does tend to work a little bit better. And then trazodone probably works the best, but unfortunately it can be very drying and irritating to the skin, and some patients cannot tolerate trazodone. Benzoyl peroxide, as discussed in the over-the-counter treatment options, is oftentimes combined with some of our topical antibiotics as well. Topical antibiotics that are used for the treatment of acne include clindamycin, erythromycin, dapsone or Axone, and then newest to the market is a topical minocycline. Once again, we see combination products of all of the above. Benzoyl peroxides and topical antibiotics such as clindamycin and erythromycin have a synergistic effect, meaning they work better together than either one of them alone. Once again, the benzoyl peroxide portion can help to prevent bacterial resistance, which is definitely something that we are looking for in our treatment of acne. Benzoyl peroxide and adaptolene came out as Epiduo, and then tretinoin and clindamycin combinations are available for as Velton and Ziana. Trazodone recently came out combined with albendazole for the treatment of psoriasis, not for acne though. Sulfur and sodium sulfacetamide. This is a less commonly used treatment for acne. It has keratolytic and antibacterial and anti-inflammatory benefits. It's used not only for acne but also for rosacea. This comes in a wash that is very nice for truncal acne. Azelaic acid is one of the less commonly used products for acne, but is one of my favorites for rosacea. It has anti-inflammatory and is bacteriostatic against P. acnes as well as many other skin contaminants. It also has skin lightening benefits. Now that we've covered our over-the-counter and topical treatments for acne, let's consider our systemic treatments. Oral antibiotics. Generally, the tetracycline-based antibiotics are our first-line treatment for acne. Doxycycline and minocycline are the most commonly used. We do think about gastric upset and sun sensitivity with these medications. Other antibiotics such as Bactrim, cephalexin, and erythromycin can be considered. Due to concerns with antibiotic resistance, we want to try to minimize the long-term use of oral antibiotics for the treatment of acne. These medications work great while our patients are on them, but they do not cure acne, so patients will frequently flare when they are discontinued. I generally will plan to treat for 5 to 6 months, and if I'm unable to transition to topical treatment, then we discuss our other treatment options. Hormonal treatments, birth control pills, or spironolactone. Spironolactone is an anti-androgen and it blocks testosterone conversion in the skin. Most acne patients will need anywhere from 25 to 100 milligrams to maintain benefits. And finally, isotretinoin. This is our go-to medication for the cystic acne. or if a patient has tried and failed the other treatments. This is a 6-month treatment course that involves monthly office visits and lab work. All patients, providers, and pharmacies must adhere to the iPledge Pregnancy Prevention Program for this medication. This is our only treatment that has a potential for a long-term benefit. Although we cannot consider isotretinoin a cure for acne, we do see very dramatic results, oftentimes to the point that people don't have to be on anything afterwards. We must use caution with this medication for patients with a history of irritable bowel disease, Crohn's disease, or ulcerative colitis, or depression. Sun sensitivity and dryness are expected with this medication. Once you've determined your treatment plan, general recommendations for skincare include to use mild soaps and moisturizers such as Dove, Cetaphil, or CeraVe. Other products may cause additional irritation to the skin. We want you to be able to tolerate your topical medications that are clinically proven to reduce acne. Avoid picking. Picking will just make acne last longer and more potential for scarring. No treatment works overnight. You must give any treatment plan 6 to 8 weeks before we expect to see improvement. At this point, I would like to discuss the application of our topical medications. In general, more is not better. More will just make you more red, dry, and irritated. A small pea-sized amount is all that you need. Dab on your forehead, chin, each cheek, and your nose. Rub it around. If you can see it or feel it, then you have too much. Specifically with topical retinoids, you want to be careful around the corners of the eyes, corners of the nose, and corners of the mouth. Those areas will tend to dry out a little bit faster. Topical retinoids should be applied at bedtime because they do make you sun sensitive. We want you to be reaching your peak sun sensitivity while you're sleeping with these medications. And you should apply a moisturizer with a sunscreen in the morning. With all topical treatments, but especially the topical retinoids, tolerability is more important than frequency. What that means is that in the winter months, you may only be able to use this medication 1 to 2 times a week as your skin builds tolerability. As you are tolerating it, you may increase it to every other day and then daily application, once again, as tolerated. If you can only tolerate it once a week, you're still getting some benefit from the medication. It is important to moisturize your skin with a mild moisturizer after the application of your topical medications. Benzoyl peroxide containing products are generally applied in the morning, but once again, we want to use caution that it can bleach your towels, washcloths, and clothing. So white towels, white washcloths. If you did use it on your chest and back, you might want to wear a white t-shirt. Frequently asked questions. Does diet affect my acne? We do not have consistent data to indicate a specific food would cause acne, but if you feel like every time you eat pizza or chocolate or have a soda, you flare, then you should try to avoid those things. There is some literature supporting a potential association with dairy, so you could attempt a dairy-free diet to see if that was beneficial for your acne. What makeup should I wear? The majority of the makeup products on the market are tested to be non-comedogenic, meaning non-pore clogging. You can look at the bottle to see if it specifically says that, but in general, if you try something new and you think it's making your acne worse, we'll stop that. Does stress cause acne? Yes. I will commonly see my college-age students flare with finals or big projects. Finally, I'll frequently have my patients say, I swear I clean my skin really well and I still get all this acne. Acne is not a dirt issue. Acne does not develop because you did not clean your face well. Overcleaning can actually result in mechanical acne and irritation. I'm not a big fan of microbeads or apricot scrubs or spinning brushes, but as long as they do not bother your skin, then you can use them. They will make prescription medications more difficult to tolerate. Other forms of mechanical acne can be seen with chin straps and shoulder pads for football players, or hat bands and headbands for people that are utilizing those those products. I'd like to thank you for taking the time to learn about acne, and have a great day.